Hi, good afternoon, or morning, or evening. Hi, wherever you are. Thank you so much for joining this live stream today. I'm Dr. Sylvia, and I run AskAwayHealth and do most of the videos on the channel. Hope you're doing well today. And if you've clicked on this because you're interested in this topic, then I hope you find the next 32 minutes or so useful in terms of going through some of the challenges that people can have using the Depo shot, that women can have using the Depo Progesterone shot. So what we have today, and from time to time I do a Q&A for the Depo Progesterone shot, and I do that as well for other birth control methods, but I do get quite a lot of questions around the Depo shot. And so when I get a few popping up in the comment section, some of them I'm able to answer, some I can't because I need so much more information. I put them together and do a little live stream so that we can address some areas, and hopefully, because many women have similar problems, hopefully somebody finds it useful. So we're going to do that today. If you're just joining the stream, welcome. Thank you so much for clicking onto this. Please don't forget to like the video and subscribe to the channel. We crossed 16,000 mark last week Friday actually, and now I think we're at 16,200. So guys, we are growing so much, and I'm really very grateful for every new subscriber and the old ones who make the channel what it is, give me the enthusiasm and give me the goal to continue doing this. So I'm very, very grateful to you guys. So let's just get cracking. Let's go on. I have six questions that I want us to tackle today. So these are questions from real users, people who watch the channel and they want information. So these are real questions, and I'm going to describe or explain as much as I can. Many times you need more information to be able to do this. And by the way, this is the first of 2 live streams I'm doing today. Last week I did 2 live streams because I missed my Friday slot. So I managed to do 2 on Saturday, I think. And then a couple of issues just came up this week in the social media space, and I did want to address them. The second one has to do with miscarriage, and I really want to talk about that. If you go on the channel in the pregnancy playlist, you'll see I talk about miscarriage, early pregnancy bleeding, high-risk pregnancy, and things like that. So please make sure you go and check that out if you haven't. So let's just get on to the first question. And yes, if you're welcome to send in a comment or question, particularly if it's related to today's topic, I will try and address that for you. If it's not, then I would encourage you to use our email health information service. The link will be in the description box as soon as this live stream is over, or it might be there already, I don't know. But yeah, please, if you're just joining, hi, where are you joining from? Please let me know, give me a comment, or if you're watching the replay, please like the video. Okay, first question, I hope you can see this. From one of our viewers. This says, I've been on the Depo since I was 14 years because of my blood disorder. Okay, because of my blood disorder. So that's interesting. And I'm 20 now. How long would it take for me to get pregnant once I get off? Now, just that comment, this is all that we've got. So again, sometimes it's difficult to answer these questions on YouTube because that's really not appropriate to, as a practitioner, you want to get as much information and know your patient so that you can guide them properly. So many times that questions come on YouTube, is just not possible to answer them. You need a proper channel where you can actually ask more questions, clarify information, see what else is going on. So I usually ask people to either go to their health providers, and if they just want to continue having a discussion with me, a second opinion, please use the email health information service. But yeah, Depo and blood disorder. One example that comes to mind that's recommended actually is for ladies who have sickle cell disease or suffer with sickle cell anemia, and the Depo shot as a form of contraception is recommended. In some studies, it actually says that it reduces the pain associated with crises, and the Depo combined methods like the combined pill or the combined patch or the ring that contain both estrogen and progesterone may not be so good for a woman who has sickle cell anemia, because containing estrogen, there might be an increased risk of strokes or blood clots and things like that. So using the progesterone method is recommended. I practice in the UK at the moment, and we follow the guidelines from the Faculty of Sexual and Reproductive Health. And the Depo Progesterone shot is a contraceptive option for women with sickle cell disease. And I'm just saying this because of this question that mentions the blood disorder. But anyway, that's not actually what she's asking about. The question is related to, now that she's 20, she wants to know, how long would it take for me to get pregnant once I get off the shot? So thank you for this question. I think I did answer it, but probably in a limited fashion. And so the question is, how long it will take for me to get pregnant? I have done lots of videos on this, so if you're familiar with the channel, or if you're a user of the Depo, hopefully you do know this, and that your practitioner or your provider had explained to you before starting it, that there can be delays with falling pregnant after stopping the Depo. Some data suggests that this could be anything from 9 months to 12 months or even longer. And if I've come across many ladies who have stopped being off the Depo for several months, going past a year, and have not fallen pregnant, and it's really it's distressing. It is it's one of the big effects of this medicine, because it's a big dose of hormone progesterone in it. But it's one that we want women to know about before they start the method, because if you know about it beforehand, then you can get your planning in right. If you want to be on the Depo shot for a couple of years and then start your family, then you already know that when it's getting close to the point when you want to start the family, 6 months, 9 months before then, you should be coming off the shot and looking at some alternative method that doesn't have such a big effect on your ovulation. So the ovulation will return. Okay, so what the progesterone shot does is that it prevents ovulation while you're on it, but that's temporary. It's not a permanent, doesn't permanently affect fertility, so it will return. Now, I can't tell you, and nobody can tell you how long it will take. We can only give estimates. Some ladies come off the shot and they can return, their fertility returns within 3 months or 6 months. That does happen for some ladies. But there are other ladies, like I've just said, where it could be a bit longer, perhaps 12 months, perhaps 18 months. The other point I want to make for this particular question is, because she's been on it 6 years is not why there's a delay. So it's not because she's been on it for so long, because I know that might be a reasonable conjecture, but that's not right. You can find people who are on the shot for just 12 months or 18 months and still experience a delay in falling pregnant. So that's that first question dusted. Thank you so much for posting it. And to the viewer, to the person who posted it, I did answer it, and I feel if you wanted more details, I think I probably directed you to my email service. If that was okay, then if my response was satisfactory and gave you the clarity that you need, that's not a problem. Okay, so that's the first question. Let's go to number 2. If you're just joining, thank you. Please don't lurk in the shadows. It's always good to know who's clicking and who's watching, although I know that some people just want to watch. I appreciate the support. Thank you. But if you're watching the replay, go ahead and give the video a like. That will be most appreciated. And of course, share it with a friend or somebody who might find it useful. So here we are on question number 2. And this says, I got my Depo shot last February 13th. So that was what was it, 6 weeks? Yes, about 6 weeks ago. Then I got my bleeding March 4th, and until now it's still bleeding. So I did, when did I post it? So I think I cropped all these messages probably a week ago or so. So I think what the implication there was that she'd been bleeding for 2 weeks by the time she sent in the message. And she still had bleeding at the time she was writing. So I'm worried and also having a headache every day. What should I do? Okay, so thank you for posting that from Philippines. Much appreciated. Thank you for the support and thank you for the inquiry. So the 2 things here that are not unusual are the fact that she's having bleeding that's unexpected or that's not her usual pattern, and the headache. Let me start with the headache, because I really want to be very careful here, and I want you to be very careful. We do know that many women who use the Depo shot and many other birth control methods that are hormonal can get side effects like headache, They can get other side effects like acne. There are other things. Of course, irregular bleeding is part of it. So these are some of the common side effects that we'd associate with using the Depo. And not every woman has them, but we do recognize that some cold. So things like gaining weight, headache, spots, even hair loss has been reported. And some women experience inflammation, or what do you call it, pain, skin changes around the injection site. Some women experience changes to the mood. Some women experience trouble, reduced sex drive, so reduced desire and sexual interest. Discomfort down below in the vagina, a condition known as vaginitis. So there is a list of different potential things that could happen as side effects to the Depo shot. So while headache is part of that group, I wouldn't immediately just blame the Depo. I want you to see your doctor. I want you to talk to your health provider so that we can establish what this headache, what the cause of this headache is. Because many things can be associated with headache, problems like high blood pressure, could it be migraine, and different causes before we say, okay, this is likely an effect of the birth control method. So please be very careful with headaches and birth control. Don't just assume that is the method. Do see your provider to check whether it could be something else before we agree that is the headache, and then decide what next to do, which might be changing the method if the headaches are so bad, or thinking about different alternative ways to do it. And then just to briefly touch on the other thing that she talked about, which is the bleeding. Well, this is the nature of this drug, and one that hopefully when you start it, your provider also says to you, there should be, when you come to that decision for using this method, the Depo shot, it shouldn't just be, okay, take the shot and then the injection, bam, just like that. No, there must be an opportunity to understand, explain to you, and for you to understand this drug and how it works and what effects to have. So if that's something that you haven't, you're welcome to look through my playlist of smart birth control, smart contraception, where I talk about the Depo shot, I talk about the possible side effects, and of course you're welcome to send a question in if you wanted clarification about it. So what should I do for this particular question or comment? I would say please speak to your provider, speak to your doctor, so that they can look at the patterns of your bleeding, irregular bleeding or unscheduled bleeding. We don't just blame it on the birth control method. We do want to make sure there's nothing else going on. For example, a sexually transmitted infection. So it's important that you're reporting any bleeding that's unusual to your doctor. Now, once you've had the test done and we're happy that there's nothing else going on, irregular bleeding is something that does happen for a lot of ladies on this method. But again, I would say the answer to this for this lady is please speak to your provider, especially if you've just started the method. She didn't say, but especially if she's just started the method, then it's a good idea to speak to a provider. Okay, so thank you so much for that question from the Philippines. Much, much appreciated. Thank you for watching. If you're joining, please don't forget to like the video as you step in. We are looking at common questions around the Depo shot, and a lot of these have come in from my viewers. And we do have a birth control playlist, and I tackle these kind of questions and also discuss Depo shot side effects as well. So we've just done 2. We're on to number 3. So we're keeping good time. This one says, I'm from the UK. I started the Depo injection 9 months ago, but I'm finding my periods haven't stopped. I get 3 out of 4 heavy bleeds. I'm considering stopping. I do already have a diagnosed endometriosis, many other things. I've tried, but it's the same effect with the pill, the coil, the implant, all made me constantly bleed. Oh, my word. I'm actually in serious pain with it. I'll bring this up with the nurse at the next appointment. So I just put this here because it's really a comment, isn't it? A comment is not really a question, but I did put this here because this is not unusual. Many ladies, and there's some that if you keep your ears open on social media in different channels, many women that will swear off birth control just for reasons like this. And my heart goes out to someone who has a condition like endometriosis, and we do use the Depo progesterone shot for women with endometriosis, because the thinking is that because the Depo shot can sometimes cause no periods, absent periods, then it may be that this can help to relieve the pain that women with endometriosis have. So we're trying to use that side effect of the Depo to provide some relief in that condition. So it's not unusual that she was prescribed the Depo shot for birth control and endometriosis purposes. What's particularly painful is that despite the shot, she's still having heavy bleeding. And again, like we said for the last question that we tackled, this is not unusual that somebody may find that she's experiencing irregular and heavy bleeding while on the shot. There's some women whom it doesn't, this is what it does. It doesn't give them the relief of no periods at all. Some women are worried, oh, I haven't seen my period for months because I'm on the shot. For some women would like that, but they don't get that. They actually have irregular or heavy bleeding. So this is just to demonstrate that this is here's somebody suffering from this problem. And yeah, if you're there thinking about the shot, please be aware that it could do this. I can't specifically say that it does that. It will do that to you. There are many women who use the shot and find it it sorts the needs. It addresses their needs. They're happy with it. So there you go. These are two different ends of the spectrum. Okay, so that's that comment, which I do appreciate. Thank you so much to the viewer who sent that in, for watching and for just sharing your experience. And I hope that when you discuss with the nurse at your appointment, hope that something can be established for your needs, because she mentioned that even the pill, the coil, the implant. So these are different methods. I don't know if the pill was the combined or not. I don't know if the coil was the copper or progesterone. The implant is progesterone. So these are different methods that she's used and the Depo, and she did have troublesome bleeding. So these are some of the downsides. I don't hide this from you guys, please. I want you to be very clear when you're using these methods. Be aware of the possible side effects. For some women, they do provide some benefit. For others, they don't. So please be aware of this possible effect. So let's go on to the very next question. Thank you so much to this viewer. If you're just joining, thank you so much for popping in and clicking on the video. We're talking about common questions that I'm getting on the channel around the Depo shot injection, and that might be of interest to you, which is fine. If not, thank you for stopping over. And if you've got a question, by all means, post it on this topic, mind you, please, and then we can tackle it. But we're looking at some of the issues that women might have. So yeah, this is an interesting one, and I don't get this kind of question often, and I just thought this is a good opportunity. Although I think I've probably mentioned it. I'm just remembering now a video that we did about undesirable Depo shot effects, and I probably mentioned it, but I might be wrong. Anyway, so this question goes: does Depo Provera affect the BMD? BMD is bone mineral density significantly when used by women over 40 years of age. Some articles mention DMPA affects the bone. Some articles mention that Depo, so DMPA there is the Depo shot, affects the bones only when taken before the third decade. What is your experience? So thank you for this question. This is really good. And I did answer it, if you can see the small print here, I did answer it. So yes, the Depo progesterone injection does have an effect on the bones and can lead to thinning bones in some women. In fact, it can lead to thinning bones in all women using it, but the risk is higher in two particular categories of women: those who are under 18 years, whose bone structure has not completely formed, so their bones are still developing, even though you can't see from looking at them that bone development is still going on. But up to that age, there is still bone growth and development going on. And in women around or after menopause, that's postmenopausal women, because some women around menopause or very, very close to menopause, before it is completely established, could still fall pregnant and could still want to use the Depo shot. So remember that menopause is when a woman has completely stopped seeing her periods for 12 months. Women don't just get to a stage and they just stop. No, what happens is that they begin to have less regular cycles. So they may miss a bleed for 1 or 2 or 3 months, and then it happens. So that person has not yet reached her menopause. You have to start counting from that point again. So if she carries on and then she doesn't have a bleed for 6 months and she thinks, oh, getting at the menopause, she needs to get to a point where she's not had period for 12 consecutive months. So before that stage, she could still potentially get pregnant, and she may still use a birth control method, for example, the Depo. So that's why these two categories of women can be affected. So for the second group I was talking about, those who are around menopause, remember that what's going on there is that you're losing estrogen. Your body isn't making as much estrogen. The problem with that is that we need estrogen to support our bone strength, to support our bone development. So women at that stage have trouble with bone development. And if you give them a drug that can affect how their bone is, that can lead to bone thinning, you make the condition worse. So they're losing estrogen, their bone strength is not very good. You now give them a drug that affects bones development, you increase their risk of very thin bones and fractures. So that is why the Depo shot is not very good news for somebody who is under 18 and for somebody who is around menopause. However, does that mean that they completely cannot use it? So for somebody who is under 18, if other methods do not work, okay, and they are aware of this potential risk, we will still, and if they choose to, the most important thing is that they are aware of the risk, and then they think this is the method that suits me, other methods don't work. And believe me, there are ladies like that. And so they decide to go on this Depo. What you want to do is make sure that they are doing other things that help to support their bone growth, and you're checking them over regularly. Some people might even have bone scans as well, but that means they're taking their supplements, their diet is healthy, their diet is rich with dairy, whichever type of dairy that they want to use, as long as you're getting your vitamin D and calcium, that will help your bone growth and development. And exercise, weight-bearing exercise that help with bone strength, you would encourage such people to do so. So what happens is, for women who get to that point around menopause and they still want and need birth control, because you say, they've not reached menopause yet, they could ovulate and then fall pregnant, even though they're having irregular periods. So we could have a discussion with them about switching to an alternative because of those risks. So the question is if it affects bone mineral density significantly. So yes, it does. And that is why we speak to women about this problem, get their views, give them the opportunity to say, okay, I appreciate the concern, I'm going to switch to something else. And we recommend doing that, especially if they are over the age of 50, but are still have not fully reached menopause. So I hope that is clear. That was the explanation I provided to them. It doesn't affect the bone density only when taken before the third decade. It can affect women in those groups. So important that the most important thing is being aware and taking the care, either by switching methods or by using making sure that you're increasing your bone strength. I've mentioned things like exercise, I've mentioned things like your diet, all this to contribute towards your bone strength. So thank you for that question. I think that's number 4. So let's move on to the next one. Okay, so this is the very next one. Give me a moment while I just review that. So this next question looks at, I think basically what the question really is about: how soon does the Depo shot start working? How soon does the Depo shot start working? So the question is, if I receive Depo shot today and have sex on Sunday, will I be pregnant? So there were really, when this question was posted, it was really a few days between today and Sunday. So just take it that it was less than 4 or 5 days. Okay, so if you take the Depo shot today and it is within the first few days of your period, so the first 2-3 days, which is usually what we recommend, that when you start a new method that you are on your period, then you have protection pretty much as soon as you're giving the shot, because we would assume that your period lasting about 5, in some women a little bit longer, the risk of pregnancy is quite low, and it can take up to 5 or 7 days for the level of hormone to get to the effective stage in your body. So for somebody if this person was having their period on the day they had the shot and they're asking about Sunday being 4 or 5 days away, then we would say, yes, you will be covered. Okay. Now, for somebody who took the shot and they were not within their period, so it was maybe a couple of weeks, the period was a couple of weeks ago, they will need to use extra protection for 7 days. So that's what this question is. Basically, this question is, how soon does the Depo shot start working? And the question and the answer is, it depends. Are you taking it? Usually starts working as soon as possible, or as soon as you've had it, if you were on your period when you had the shot, or if you were not on your period, you need to give it 7 days. If you're going to have sexual intercourse, use protection, use extra protection before you can be confident to go with just the Depo. Okay, so moving quickly on, please don't forget to like the video if you're just coming in. We're going to be rounding up very shortly, so if you've got any questions that you wanted to throw in on this topic, pop them in. Oh, that was the one we just did. So the last one, is that the last one? Yes. I'm sorry it's so small, but I'll read it out. My first Depo shot was in 2020, and I stopped it last year, January, which is January 22. So she had it for 2 years, and she's been off it now since January. I got my period in August. So if you're watching right from the beginning, remember we said this about delayed fertility, delayed ovulation, and periods. So this was from January to August, which was 8 months. So 8 months delay that before she got her period. It's been heavy bleeding. Yes, I gained weight. Before my period, I always have sore breasts. I want to conceive, but nothing. So this is a question about conception, about getting pregnant after the Depo. So she mentioned she's having heavy periods. She says she's gained weight, and she always has sore breasts. Okay, so there are a few things here to consider. The fact that she's having periods, that she's having bleeding, suggests that the ovulation is going on, suggests. Okay, we don't know for certain. Again, why we can't answer these questions on YouTube. I know I'm banging on about this and I apologize, but I really want to make sure that we care. Those of us that provide medical information on YouTube care about providing information, not doing a consultation. That's not my goal here. I can't do a consultation here or in the comment section. And if you need a consultation, you need to sit down with your provider. If you wanted to discuss more about the condition, then I do have outlets that we can use to sit down together, get more information, and hopefully put you in the right direction. But going back to this, so there's a suggestion that she is ovulating. One challenge, perhaps that's unrelated to her Depo use, is the fact that she's gained weight, because that may affect her ability to gain weight. Sorry, to fall pregnant. So we do want women to be at a healthy weight. That's the word I'm looking for. Healthy weight for them to get pregnant, because very high estrogen levels, which can happen if you're overweight, may affect your ability to fall pregnant. So having sore breasts before the period could be something to do with PMS or PMT, or just premenstrual symptoms. So for this lady, I think it's worthwhile sitting down with her doctor or seeing a fertility specialist, because now it's been 12 months plus 2. It's been 15 months, isn't it, since she stopped the shot. Her period started about 6 months ago, so presumably she's been ovulating, and so it will be useful for her to see a fertility specialist, maybe have some tests done, look at her 21-day progesterone and other markers, see if it's something to do with her weight, see her partner as well. So I wouldn't just blame the Depo shot as being the one that stopped her from falling pregnant. There are a few things to consider around here. And by the way, if you're interested in this particular kind of question, I do have a couple of videos, and I hope I'll remember to put the links. But if you go to the smart birth control playlist, they're quite recent, I think within the last few months, where we talk about delayed pregnancy chances after stopping the Depo shot. So there are a couple of them that are related. I look at what causes delayed periods and how it's not, don't just blame the Depo shot. There may be other things that might be responsible for either not falling pregnant or for your periods not coming back when you expect it to. So, wow, we finished within half an hour. Amazing. Guys, thank you so much for watching. I hope that you found this useful, this Q&A useful. Like I said, I do this every so often. Probably next time I'll tackle another birth control method. Let's see what kind of questions come in. But yeah, this is the place for your birth control needs. This is the place for asking those questions and trying to understand what happens and what to expect. We talk about it in different playlists. We address it to some extent, maybe in the comment section. But if you want to get in touch with us, please use our email health information service, links in the description box below, or go ahead and use our digital concierge. If you go to the website, you will see what that looks like and what it involves. Thank you so much for watching. Guys, I'm coming back in just half an hour because there's another topic I want us to talk about, and it has to do with miscarriage and faith. So if you're of a religious a mindset or religious faith, and how it affects your choice of medical treatment. And it's all because of a tweet that was shared by a highly influential authority figure in Christianity in Nigeria, and the tweet just took a life of its own. It just blew out of the water. And I know there have been lots and lots of discussions around it, but I want to look at a lot of the health implications, and particularly for those who may not know why there is concern, may not sort of be, yes, we know that if a woman is bleeding in pregnancy, it's not a good thing. But why we particularly want women to come out and talk to their providers if they're happening. I really want to look at that. So that's just in about half an hour. Yeah. So if that's something that interests you, you're welcome to join. But thank you so much for being with me at this point. I do hope you have a very good weekend, and I will see you again in the next one. Bye-bye.